Hello, good afternoon. Welcome to Little Steps Facebook Live. So we're about to get started, but a few friendly reminders. So we are live every week, usually on Mondays, although we will be switching that day to Wednesdays pretty soon. And if you're interested in any of our events, please go to our Facebook Live page and you can see the interviews that we'll be doing, and you just click interested and you'll get a friendly reminder on your phone. So also, of course, subscribe to our weekly newsletters from all the major cities, from Singapore to Hong Kong to Kuala Lumpur. The link is in the description, so please click that link. We are also live, of course, so feel free to interact with us. Ask us any questions. We can answer them immediately here with you. So we look forward to your questions. So let's get started. Today's topic, we are learning about allergies. So today, if most parents, of course, naturally, no parent wants their child to suffer from any allergies, but this can be a common occurrence in most children. From food allergies to skin allergies to even seasonal allergies, all children can develop an allergy. So today we're going to be delving into that and discussing the types of allergies kids could have. So, for example, among babies, a lot of babies can have rashes, so we're going to be discussing that from we're going to be early identification to causes to remedies. Welcome, Miss Dr. Sonal. Let me try to say your last name correctly again. Hattangdi-Haridas.
That's
yes.
pretty good.
I've been practicing, so welcome. So here today we've got Dr. Sonal. She's the director of Maya Health Institute of Hong Kong. She has been in the private practice for over 20 years and she has a global clientele. So today we're also discussing, she is known and sought out for her effective complementary homeopathic treatment and of recurrent allergies. She uses homeopathic remedies and nutritional supplements as well as nutritional advice. So today we're going to be discussing that. Looking very forward to it. So welcome. Can you tell us a little bit about yourself, please?
Well, I've been in homeopathic practice for over 20 years and I've been using nutritional changes in my practice very early. More recently, I've just finished my master's in nutritional medicine from Surrey to complement that. My mission in life is to help prevent allergies and prevent illness, and there's a lot we can do in the realm of preventative medicine, which we really need to look into in today's day and age where we know that antibiotics are not working as well as they used to be, and we can only do that with support from parents and support from the medical community as well as complementary practitioners. This is why I come to work every day.
Great. So how did you get interested in homeopathic treatment?
When I was 8, I was told that my tonsils were so riddled with holes that I need to get them out. And my mother, who had a homeopath, went to her and started on homeopathic treatment, and I still have my tonsils.
I actually got mine twice removed.
So I was a homeopathic patient as
Yeah.
such for most of my life. I grew up in the Middle East, and because of I was looked after by very good pediatricians as well. But my mother always had a homeopathic physician, so much of the therapies given to me were homeopathic, and I needed antibiotics till I went to university. I think I've had antibiotics only twice in my life, which is a big deal if you think of how quickly a person can be given antibiotics in today's day and age.
Especially as a female with bladder infections. And
Exactly,
such,
so many things.
Yeah, exactly.
And as a younger person at school, and
Yes.
so I have witnessed homeopathy myself on my body, so that's how I began to read up more on it. I'm a biology geek, so very early in my life I started reading the textbooks and trying to see the scientific data and the pathology. It was very, very interesting, so I made a conscious decision to go back to India to do my homeopathic medicine, because it's one of the 3 countries in the world where you have to have a certain amount of medical knowledge to practice homeopathy. Okay. So my course was a 5.5-year course with 1 year of internship in a hospital. So you start working in a public hospital, you start studying in your second year itself. So there's a lot of interaction with medical professionals, and they teach you what you can do and what you can't do. So you know the scope of homeopathy for every disease, which is very important.
That is.
So you work complementary from a very young age in your practice to show that where you can fix things faster when it's primary care, when it's early, what we call early intervention, and that's where allergies come up, because you help allergies early and they don't go further ahead.
Perfect, perfect. Well, let's delve right into it. So, as usual, we have divided our topic into 3 stages. So, first, we're going to be discussing early identification and symptoms. Secondly, what is the treatment? And finally, steps a parent can take at home. So, also, friendly reminder, we are live. Any questions, please bring those in. Thank you. So, let's get started. So, early identification and symptoms. So, families who have a history of allergies in their family, is it quite common for that to move on to the children?
When there's a history of allergies in the family, especially what we call atopic diseases like eczema or asthma, what I would suggest is, yes, keep an eye out, because there is a 5% a higher tendency for the children to have one or the other allergies. But unfortunately, in today's world, allergies have exponentially increased in manifestations. So people who do not have a tendency to allergies, their children can get allergies.
Okay.
So a general awareness is important. When I was in med school, they said 5% chance of an eczema family having a baby with eczema. But now, even families who do not have a tendency for eczema, you do see that the child might get atopic dermatitis or allergies. So things have changed.
Things have changed. What are the common allergies amongst children, the most common ones, let's say?
From a Hong Kong context, the most common allergies that you see is the nose allergies, the rhinitis. Of course, because dust mite is a big issue in Hong Kong, because the humid weather in Hong Kong, about at least 9 months in a year, the humidity is above 85-90%. So that's very conducive for mold growth and for dust mites to thrive. So nasal allergies are very common. The second most common allergy is skin issues. And sometimes when skin issues are not appropriately addressed also, and otherwise you tend to have bronchial issues, respiratory issues. So respiratory allergies are much more common in Hong Kong.
Okay. So, and how early does it develop among children? How early do they find out the symptoms? Let's say, if it goes for eczema or something, let's say eczema, how different is a baby rash from a diaper rash to eczema? What are we looking for to go to a doctor?
When you think of allergies, if you want to think of the timeline, you may have certain signs and symptoms coming up pretty early, as early as a few weeks old or a few months old.
Okay.
And it's important for parents to keep an eye out for these things, because if we make certain changes at that time and help them, we can actually prevent things from going further ahead.
That's fantastic.
It's very important for example, for a baby, a newborn baby, and the first few weeks, usually, best case scenario, they're hungry, you feed them, you burp them, they poop, they sleep. They wake up again, of course they cry, that's normal, but they demand feeds.
Yes.
And usually the pattern continues, because their job is to sleep, eat, poop, sleep again. If in that cycle you notice that your child is more uncomfortable than should be, is gassy, is waking up at night, if the skin starts to be rough, if there's something unusual coming up, it's worth going to a professional and saying, hey, is there something else I can do? Is there something going on?
Perfect.
And I must stress, it's important to go to a professional and not just Google it.
Background checks.
Exactly. So it's very important that you do notice these changes. When you ask the different allergies, so one being the nasal one to all the way to eczema. So
yes.
they're different patterns. For very young children, in a healthy situation, little baby should not be having nose blocks. Okay, so if your baby's having nose blocks, pay attention.
But then let's think of when a baby is crying, it's automatic that their nose will get a little bit blocked.
Yeah, but
So
it should.
Yeah.
But if your child is sleeping at any age with their mouth open, you need to pay attention.
Okay, perfect.
Mouth breathing is something, of course, even with older children,
Yes.
it's not okay.
Okay.
If there are little bumps on the skin that keep coming up and going away, even if they're going away and they keep coming back, we need to pay attention to why is that happening.
Exactly.
If an older child is is passing is has poo poo more than
Mm-hmm.
3 times a day. There's something going on there.
Yes.
If a baby is not poo pooing almost every time they drink breast milk, you
Then
need to
there's
pay
a problem.
attention. Yeah.
Is this also, this is a question, breastfeeding, is this something that parents should be aware for? Let's say if the child has a food allergy, the baby, can breastfeeding affect the child?
See, breastfeeding is the best for the child. I mean,
Okay.
I call it liquid gold. You have to. There's
Absolutely.
no alternative. Formula is there still isn't. They're still working on it. There are a lot of companies that are trying very hard,
Mhm.
but we still haven't been able to mimic breast milk in a can.
But
Yeah.
should mothers be careful with what they consume in order to regulate their breast milk for the child if the child
They
is
may need to. It
Okay.
depends, but that comes to where we can protect from allergies. I always
Yes.
suggest that mothers, when they're pregnant, it's best that they have a variety of foods. Don't narrow your food, the food groups that you eat, or choose wisely.
Mhm.
Choose whole foods.
Mm-hmm.
Make sure you don't have too much processed and not too many E numbers in your foods.
Yes.
Make sure that what you eat is fresh. When you're pregnant, and that actually reduces the chances of allergies in the baby, in the
Mhm.
newborn. When a baby is showing some symptomatology,
Yes.
you may want to have a professional look at your diet and say, okay, how do I support this?
Mm-hmm.
But it's more concerning when mothers blanket stop things
Yes.
because of something somebody told them in a forum, and they end up being more malnourished
Yes.
than they started off to be. So it's choose wisely how you would eat when you breastfeed. You make informed decisions.
Of course. Of course. Now, just to go around the point, how important is early identification when it comes to allergies, and how do we stress the parents to go to the right people to see for the allergies?
Allergy is, if you look at it in a bigger picture, it's an inflammatory process. It's a swelling.
Mhm.
So somewhere inside, your defense system your army is getting instigated to a perceived enemy.
Mm-hmm.
We can't ignore that.
Of course.
So what we need to do is help ensure that things calm down and there's a balance.
Yes.
The earlier the better, because it doesn't go away. If you do things to just suppress that on the surface, and things are still going on inside, it shows up as something else.
Ah, okay.
There is a strong relation between allergies, infantile allergies, eczema, and later diagnosis of ADHD, autism. Of course, you know about ear infections being
Yes.
woven. So it is something that if we deal with it earlier, then we can help, prevent a lot of things from happening.
Perfect. And how would you advise parents to seek for the right people? As we said, it's very important to seek the right people. To not go online, do we contact our GP, or do we go straight for the source and find the right people with the right background?
What I would advise parents to do is ensure you have a good team around you, a GP who is well informed about allergies,
Mhm.
and keep abreast with the latest information.
Okay.
A lot of the evidence for, especially with nutrition and allergies, has been recorded and documented in the last 10 years.
Okay.
So make sure your physicians all around you are aware of the latest and keep themselves alert to the latest information around.
That's great advice.
So and also when it's a baby,
Mhm.
it's when a child, especially when a child is not, at that stage when they still can't express, verbally
of course.
express, err on the side of caution. We don't know how uncomfortable they are.
Exactly.
So as a parent, so you need to go to a professional to have them checked. Just don't. It's better not to just speculate on.
It's fine.
Yeah, it's fine. Just sleeping
Just
a bit
crying.
more.
Yes,
Yeah.
exactly.
Exactly.
Well, we got a question, Natalie. Thank you for your question. So, what can open mouth breathing meaning in a kid while they're sleeping? I imagine.
Okay, so in terms of age, if it's of course in infants, it would be more of a nose block, and it could be to something in the area. For an older child, it could be the adenoids have enlarged. Therefore, when they sleep at night, there's a little bit of a block of the nose, so they end up opening their mouth to breathe. Adenoids are lymphatic tissue, so they're like our security guards up back of the throat, like the tonsils are in the throat. They tend to get inflamed when there is an allergic situation or an infection. So you can have a swelling of the adenoids that makes the child breathe with the mouth open, or they can be what we call an hypertrophy, where the number of cells have gone up because they felt the need to defend themselves against something. When it's an inflammatory process, a swelling, that is easy to bring down with natural therapies. But if it's a hypertrophy, then you definitely need to have an ENT support you with that to help remove the adenoids.
Perfect. Thank you for your question, Ali. Keep them coming, all the questions if you have any. So we're moving on to the second stage of our interview. So we're now going to what is the treatment? We've just covered what are the early symptoms and identification, and we're now moving on to what is the treatment. So from what I've read, and you're probably not going to like this, but from what I've read, around 10% of children suffer from eczema. It's quite a large scale allergy. Now, some have it worse than others. How do I identify it, and what is a different treatment for them, especially among children?
Eczema is a more common word for medically what we term as atopic dermatitis.
Okay.
It's a broad spectrum of, it's multifactorial, and therefore the medical community has had issues with really curing it as such. There's no known cure for eczema. But there are, and children come in, and even adults with different situations. The most common one is that they are sensitized to things in the environment, and then the skin reacts. They have found 30% of the population actually have a genetic issue with the barrier protein of skin.
Okay.
And there are another percentage now that we've realized have issues with vitamin D receptors. And therefore vitamin D is also very important for the barrier layer of skin, and also for the innate immunity, the soldiers that protect the skin on the outside. So when a person has issues, genetic issues with either making vitamin D3 under their skin, or actually it being recognized there, they tend to have eczema.
Okay. And the treatment for it is it cream, or what exactly?
There is a place for everything.
Okay, there's a place for everything.
Yeah.
Depending on how it flares up. Or
exactly, on what situation
it is. If it's stress related, food related.
Correct. And
Okay.
eczema can be an acute phase. It can be somewhere between acute and chronic. Then in a clinical presentation, sometimes they have secondary infections on top, because when the barrier is not okay,
Yes.
they're more prone to infections. So it has to be looked at. Each individual has to be looked at as to what situation they have at present, and
Okay.
help them with that.
And can you tell me, as you said, what is the homeopathic treatment that could go alongside with the normal treatment of eczema?
Homeopathically and nutritionally, how we support
Yes.
eczema is what I try and do is to help reduce the itching, so relief of symptoms, because itching is a big thing.
Because you don't want to scratch off the skin, of course.
And you have situations where children cannot sleep through the night, and they're awake for about an hour and a half in the night, and just riddled with scratch marks, and the parents, it's very sad when you hear of children who cannot have a good night's sleep because they're so uncomfortable, and they have to then pay attention in the classroom the next day. So how I work is we support relief of the symptoms first, then we support healing of the barrier. My work with nutritional medicine had to do also with vitamin D, so giving them the right amounts of vitamin D to support the new skin, making sure the barrier improves. In identifying the triggers is important. It's not always easy to identify all the triggers.
It is very hard, especially with eczema. I find that the triggers can also alter in time, that one day it was stress related and the next day it is food related.
Correct. And also because if you think of our immune system as different, just like the army, you have the navy, you have the air force, you have it depends on how many of those forces have been triggered, and sometimes it's three, all three or more, and it depends on which triggers are igniting which particular force at that time.
And how early can parents see? When does eczema start to develop in children? Is it quite early on?
You can, from my point of view, you can tell something's going on within the first maybe month and a half.
Okay.
By 3 months for sure.
Okay.
But yeah, by 6 months you would know. Eczema does not always start in childhood. You can have atopic dermatitis developing later as well.
I got it later in life, yes.
Yeah.
It was stress-related mine, so it only comes and goes.
Exactly. So it can be at different stages in life. It could be because of stress, like you said. It could be because then the child, sometimes it happens in high school and university because they don't spend that much time in the sun as they used to. They're not on the playground anymore.
So it's very fickle. It can just develop.
Many things. It could be a diet change,
Okay.
a fad diet, something new. So you decide to just change something completely, and your body doesn't like the new food. We don't know. We're not sure.
And would you advise them to go see a doctor and see what potential causes there could be and how to alleviate that or how to stop?
Rushing to find the cause always does not work. It can be a very expensive path.
Okay.
And does not always identify all the triggers. So it's a matter of balancing cost and benefit.
Yes, of course.
So if you can help someone and sort of as a professional, many professionals, it depends on how they would approach the patient. If you can help them with identifying a few common triggers that most professionals know of, and then that's good enough. But if there's something that's still lingering, then you need to really dig deep.
Okay. And how is eczema connected to chronic bronchitis?
It's something that pathologically is called what we call the atopic march.
Okay.
So children who have a tendency for eczema, the inflammatory irritations tend to go deeper into the respiratory system. A lot of parents can identify with this, where they have a child with eczema and they put the creams on and the eczema disappears and they think everything's fine, and within a few months the next cold leads to nebulization and having to use the puff, and later on possibly the child being diagnosed as asthmatic.
Okay. Can one develop, so let's say if you have chronic bronchitis, will eczema then, will one be more developing than the other, or do they go hand in hand?
It depends. For some who have who are older, they have the bronchitis, but they used to have eczema.
Okay.
Okay, and then some would have eczema, but it wouldn't have gone towards bronchitis.
Oh,
so
okay.
it depends on the family situation, tendencies, how well they've changed their situation around them.
So bronchitis.
Bronchitis.
There you go. Thank you. And how do we see that in children? It's just, again, breathing, just checking on our child's breathing, see if they're...
Usually doctors would identify bronchitis, and if the child needs, very often every cold starts going into the chest, you need to pay attention. Why is every cold going to the chest?
Very good.
That's not okay.
No, definitely. Okay, now moving on from eczema. We've got a question. Hello. Eczema, I believe, is your... sorry. What is your take on using steroids for treatment for eczema?
I'm a homeopath and in nutrition medicines I don't use steroids for eczema. But as I mentioned, even with dermatologists and pediatricians, there is a time and place when it may be required in terms of the creams. And many of my clients, they tend to use them if they need to or want to, and I'm fine with that. I don't prescribe them myself because I'm neither a pediatrician nor a dermatologist, but I try and support my clients so that as far as possible they don't need to use it, because it is not a cure-all. It does work well, yes, we know, and there is sometimes we do need it, but as far as possible, if we can avoid it, and by using something natural, making some changes, why not?
When our children some of our kids could have hives or swelling can develop all of a sudden out of nowhere. What could cause this, and how do we respond as parents if this happens?
Now, hives and swelling is a bit of a different story from eczema.
Yeah, you were moving on from
yeah.
Yes.
In hives, and it's an immediate defense mechanism,
Okay.
where they think they're under attack. Hives are what we call urticaria, which is just very superficial. It's
So
on
large
top.
bumps. kind of-
Bumps, yeah, like
Is it liquid inside?
not
Not
necessarily, but they
necessarily.
blanch on pressure when you press it.
Okay.
And when you say swelling, the
Mhm.
other swelling,
Mm-hmm.
which people are concerned about, which is the one that parents also should be very aware of. It's called angioneurotic edema, and it's a swelling that's within the skin. It's under,
Okay.
and those sort of swellings you must pay attention to, and definitely consult an allergist, a pediatric allergist for your children, because those are the ones where if the swelling comes up in the throat, it can be life threatening. Those are the kind of allergies where you need an EpiPen.
Yeah, EpiPen, exactly.
So if you find your child is getting hives or swellings you're not sure of, it is extremely important that you see your pediatrician and talk about
Okay.
it, or your GP, and ensure that an allergist has a look at your child.
And what can cause them? Is it usually food related, or is it perhaps something outside, a seasonal thing that can cause?
It can be many things.
Okay.
It can be, and there are tests that the allergist will do to try and identify which ones they are.
Okay, perfect. What are the type of allergies that can go away over time? Let's say are there any food allergies that we could, let's say if you're allergic, usually with food allergies, once you're allergic to the food allergy, there is no coming back from that.
Not necessarily.
Not necessarily, okay.
No, it depends. So, depending on the various types of allergies, some children do outgrow some of their allergies. Not all.
Not all.
There are some types of food protein allergies which are quite notorious for hanging around, and those are the ones that you need to desensitize for with an allergist, which is very important when our children are out there and we're not really sure what they might accidentally put in their mouth.
Yes.
But in terms of eczema, sort of the more
Yes.
chronic allergies, there are definitely ways of outgrowing many of them.
Okay. And when it comes to food allergies, how do we actually know when our child is allergic to the food? Do we only know until they tried it and we see that they've got the allergy, or should we get them tested before that?
It's illogical to test before someone tries something.
Okay.
Because you have to remember, this is very important, because there are a lot of tests out there, and some of the tests are now being done without medical supervision. When a test comes negative for something, it doesn't mean your child does not have an allergy for it. It may mean that your child has never eaten it before. When we test, when tests are done for allergies, they check for the soldiers for that particular protein. And if the child has never had that food, the soldiers have not formed for that because they've never really seen the enemy. And
yes.
that similarly happens after elimination diets, because I've seen a lot of advice on forums about elimination diets and this and that. And then after many years of not giving the child something, they do a blood test and say, hey, everything's fine. And then they decide without medical advice to start giving the child that again. It's like the only reason there were no soldiers is because there was no enemy for the last 3 years. So that's why it's very important to have a good team around you if you have a child with allergies, and to support the treatment.
And how when we're going back to the, what did you say, the pen for, what's it called again, the EpiPen. How do you advise parents to use it?
No, I don't know. But
when do you get the EpiPen? Is it just for food allergies, or also it usually tends to be for food allergies?
It's not my forte, but I can give you an idea that if your child has hives or has any sort of choking and vomiting after food where you feel it might be an allergy, you should see an allergist.
Okay.
And they would be the ones to advise you, do the right tests to identify, and then provide you with the EpiPens.
Perfect.
And but it's important. It's not something that can be ignored.
No, exactly. Coming to babies now, babies often tend to have diaper rashes, and this is a common thing that you see all over the web, diaper rashes as well. What is the cause of that? Is it just the diaper itself? Do you need to switch diapers, see how many?
Again, from a Hong Kong perspective, because we have high humidity for about 9 months in the year.
Yes.
It's very uncomfortable. If you think of yourself as an adult in a diaper all day long, you can imagine, diaper rashes.
Have a rash.
So exactly.
With their
exactly, it's thick and it's sticky, and it's important to ensure that there is good ventilation between diaper changes. Have some because more commonly in Hong Kong, you
Mhm.
tend to see yeast infections or fungal infections because of the humidity, and so make sure your children grow, which is fantastic. But then your diaper sizes need to change
Of course.
with that. The second thing is, of course, the brands. There are different brands, and in practice, you see some children react not well to certain brands, and when you change the brand, it improves. Um, the areas where there's a rash could make a difference and give you an idea of what could be causing the rashes. If it is more towards the sides, towards where the elastic is of the, it's also possible that the child might have issues with elastic latex.
Yes.
It also might be sweat. If it is more towards the area, the anal area where the poo comes out of, if it is chronically red, you want to think in terms of, does my child have a lactose intolerance, because the stool will be more acidic.
Yes.
You want to think in terms of, in older children, could it be worms, could it be pinworms?
Of course.
Yeah.
These could.
Yeah.
Yeah.
And then sometimes a lot of baby products nowadays tend to have a lot of natural organic.
Yes.
Is the buzzword. But we have to remember, some of those things can sensitize children who are sensitive and actually make them allergic to it. And secondly, many of those very soft natural have not been tried in humid Asian climate.
Okay.
So all the testing has been done in a different climate.
Okay.
And you may need something else for the Hong Kong perspective.
Yes, that's a very good comment. Thank you. I've got another question. Thank you, Ida. Hi. So my son gets very bad reaction. There we go. To mosquito bites, swollen and hard around the bites around his skin. Haven't got it checked out, but wondering if we should. Any help on home remedies when it comes to? Is that the skeeter?
I'm from India.
Okay.
And I would say you want to protect your child against those mosquito bites in the first place.
Yes.
Yeah. It's not even in Hong Kong. We want to make sure that the child is not bitten in the first place. Some children, when they're younger, do react to mosquito bites. It usually isn't a big concern. Just using a mild lotion to just cool it down should be enough. But in some susceptible children, too many insect bites can actually cause a reaction, a breakout of hives or urticaria, so you want to watch out for that. But please do protect your children against mosquito bites in Hong Kong as well.
And it is, from what I've read, there is such a thing as a skeeter disease where some children can be allergic to some bites. Yes. Let's say if they move to another continent, then the poison within those mosquitoes are a little bit different and they can react differently, yes?
As I mentioned, mosquitoes can do a lot of that.
Yes,
you don't want to be bitten by them in the first place.
I agree. Yes.
So it's just safer to not be bitten by mosquitoes in any country.
Okay.
So it's just be a bit cautious about it. Have the right patches in the places to keep the insects away from your child.
Perfect. Going back to what you said about all the buzzwords being organic and products are safe. What are we really looking out for to know if the products are organic and safe for our children?
Now the thing is that most people confuse organic and natural as non-allergenic.
Okay.
And that is where you need to realize that just because something is natural and organic doesn't mean it's hypoallergenic or non-allergenic.
Yes.
Our body reacts to proteins and alkaloids in certain things, and many of the creams or the body lotions, the things that we apply on our children could actually be making them more allergic to something. Okay. So if you do notice skin rashes, if you do notice something odd, some redness, please look at whatever products also going on the skin.
Okay, great, thank you. So we're going to be moving on to our final chapter already of this. So we've had 3 sections. We've covered what are the symptoms and the causes. Now what is the treatment? We're going to the final one. What steps can parents take at home? So when a child has an allergy, how important is nutrition when it comes to alleviating the allergy? I guess that depends completely on the allergy, of course.
Not necessarily. If as a family you decide to go more whole food eat things that as far as possible you know what is in it, every ingredient, you would be saving your family a lot of reducing the tendency for allergies in your home. I'm a big believer in home cooked food.
Yes.
I'm a big believer in, it has to be simple. It doesn't have to be fancy. Even if it's 2 or 3 things put together, at least you know what went in there. Anything that comes out of a packet, you really will not know everything that has been put in there, especially because labeling laws in Asia are not as strong as in other countries. So err on the side of caution. Go simple, go homemade. Avoid things that come out of a box or a packet as far as possible.
Yes.
And you would be supporting a healthy environment.
And do you give this nutritional advice? Let's say if somebody comes into your practice and they have an allergy, do you also give additional nutritional advice on how
Yes,
to
I
do?
Yeah.
Perfect. So, how, does someone need, if your child has an allergy, do the parents need to inform the school of their child's allergy?
It is important. I think it's
Even with minor things. Let's say if it's eczema, you don't want. Would you want the teachers to know? Let's say.
I think it is very important, because in my practice I see people with adults with eczema as well as young children and school-going children.
Yes.
And especially when a school-going child has eczema, when they sit in an uncomfortable environment, they can actually it can actually reduce their attention in the classroom. I've personally, when my son was younger, I've actually volunteered in his classroom space, and I do remember seeing a child with eczema actually coming in and sitting down for carpet time, and I saw him flushing red, getting itchy, and a really deep cough starting up, and he starts scratching, and the poor child is just within 5 minutes he's miserable. And all the difference would be if you ask your teacher, can my child sit on a chair during carpet time, because we know he has an issue with dust mite, it would make all the difference for that child. So it is important to inform the class teacher of what he can and cannot have, or where he can and cannot sit in terms of his allergies.
Of course. Now I know this is not your forte, but let's say if they did need an EpiPen in this scenario, do you give it to the teacher, would you reckon?
I think it's a school nurse.
The school nurse,
and
yes.
But the school has to be made aware of the allergies.
Of course.
Because
when it comes to a more intense one, it could be
course.
life or death. Then
Yes,
definitely.
definitely.
Okay, great. How can a parent prevent an allergy developing in other complications? So let's say I've also read that often allergies can develop into other things, let's say into ear infections if ignored. How does a parent know to stop this from developing into other allergies?
As I mentioned before, allergies usually mean that there is inflammation.
Exactly.
So when it comes to ear infections, we're talking about inflammation in this area.
Everywhere,
so
yes.
the nose and that's where the adenoids and things come in. And what happens is we have a tube between the nose and the ears called the eustachian tube. And that's what, as adults, when we have a cold, that's what tends to get blocked and you have ear popping sometimes. So in children, that tube obviously is shorter and narrower. And so if there's inflammation there, if there's a nose block and inflammation, it gets blocked. So effectively, the drain of the room, which is the middle ear, gets blocked. And when fluid fills in, and it's very easy for bacteria to just form a little community swimming pool there, and then they get ear infections more easily. So if we can support, make sure that this area is decongested, it would support preventing ear infection.
And this is something that we'd have to check quite early on, because I feel that this would move quite quickly.
If parents realize that the child has nose block consistently, or like a mouth breathing,
yes,
then you would want to get support to help that, so the child sleeps more comfortably, everything's decongested, and it should be much easier to prevent other things.
Of course. So, how would how long would it take to see any results from homeopathic remedies and nutritional? When we're switching, are these mainly an extra compared to the remedies that already exist, or would you, let's say if somebody would come in for an allergy here, do the homeopathic remedies come in additional to the normal remedy?
I do not stop any conventional remedies that the person might be taking, a child, and all my patients have their GPs and pediatricians and allergists, so I don't stop any of the treatment.
Okay.
So it's complementary to the same. And many of the families who come to me, they've already done the antihistamine,
Of course.
and they have some lovely doctors who tell them, you know what, I don't want to give you something stronger than this,
Yes.
because just sort of manage more naturally. So then they prefer only doing the homeopathics and the nutritional.
Why do you think parents seek out for it now? More nutritional and homeopathic remedies compared to what we've already known for years.
Because in the natural realm of things, we can support things earlier before things go too bad.
Yes.
And if we, in primary care, if we can support things naturally faster before, when there's just a little bit of smoke before there's a raging fire, why not?
Of course.
So then we prevent the fire.
And when it comes to homeopathic remedies, you said before, it's all about the individual. Exactly.
It's very individualistic.
What kind of testing, or talks, or can you take us through the examination or how to test one for individualized? What kind of what can a child or a parent expect when going through this?
It's we do a complete case history where we ask a lot of details, and then there's a physical examination as well.
Yes.
And if I need some support with blood testing, I send them back to their GP or pediatrician requesting some tests that I would need for the nutritional part, like a vitamin D test. So then I get that as well.
Okay,
and so we look at it comprehensively and then prescribe.
And that is both for kids and for parents, I imagine, as well. Do often when parents and kids, let's say, have the same allergy, would they also have the same homeopathic remedies? No, because they're individualized.
Yes,
completely.
and by then, like if a baby has eczema and say the father has eczema, by the time the dad has dealt with it for so many years, the pathology has changed. It's now chronic atopic dermatitis, and there's a different physiological scenario.
Sorry, we have a giggling cast in the back. So, one of the questions that also came in, do parents need to take any preventive measurements for the child's allergy? Do they need to go to the school and ask for any preventive measurements from the school?
There are, you can, and there are some schools who've been very supportive. For example, if a child has sensitivity to fabric, and then they make sure that they have a non-fabric chair around them. And so there are ways that you can, foods as well, that they make sure that they don't share the snacks.
Because this is also, I can imagine that when your child has a food allergy, I guess that the chefs will need to separate. They'll have to, let's say if it's a very severe peanut allergy, I guess it'd be quite difficult. You just have to bring the home-cooked meals from home.
It depends, on the different schools, but it's always safer to err on the side of caution with those sort of food allergies that you're discussing.
Of course.
Definitely err on the side of caution with those.
Perfect. Well, we've already come to an end of our interview. Thank you so much. If you'd like to add anything to our interview, any questions that I might not have said, if you want to add anything. If not, we're good.
I think what's important is for parents to know that if the skin looks different, if there's a rash, please pay attention to it. The body has its own wisdom. It starts showing us signs and symptoms that something's not right, it doesn't like something, and we have to respect that. It's best to pay attention to it early, and so we can sort out the problem before things go out of hand.
Thank you. I want to thank all our viewers for checking in with us today. If you have any questions, also please continue to ask us questions. We can still answer them. We're going to be live again this week on Thursday with Toys Club at 12 p.m. Please check in for that. That will all be on Facebook. And thank you. Thank you for joining, and we'll see you soon. We'll see you on Thursday.